Hi, it's me, Dr. Daniel, and I wanted to share this quick video discussing the important biomarkers if we're wanting to understand blood sugar regulation. This is actually a panel from a really good friend of mine, and I thought that it was a great example of somebody that takes care of themselves, right? Or at least they think they're taking care of themselves. They go to their doctor, they have their annual visit, and their doctor tells them that everything's fine, that all their labs are normal, there's nothing to be concerned about. And this individual doesn't have any symptoms, by the way, right? So just assumes everything's okay as well. And of course, he shared his information with me and just wanted to know what my thoughts were. Sure enough, first of all, he didn't have accurate testing done. When they looked at his, they did what you would call a routine blood chemistry panel, which typically consists of things like your cholesterol, a metabolic panel, which would include blood sugar by itself. It included a CBC, or a red blood cell count, and white blood cell count. And that was pretty much it. That's all they looked at. They also looked at vitamin D, which again, is like, okay, wow, that's great. At least they looked at that. Now, when we talk about understanding blood chemistry, I always say the more data you have, the better. If you're getting routine blood chemistry testing done, it's enough to make sure that you're not going to drop dead. It's enough to make sure that there's nothing urgent, but it's not a really good indicator of overall health. And so if you're relying on annual visits with your doctor and all you do is get a routine assessment, and when they tell you that everything's okay, that things check out, that only means that from what they looked at, things are okay. There's a lot of other tests that are likely not being ordered for you, and that allows you from missing the opportunities of intervention to prevent problems. And like I said, this is a great example of what that looks like. Starting off, his blood glucose was in the 90s. His doctor told him that was nothing to be concerned about. Those are good numbers. This is important to understand. If your blood sugar is above 90, on a 10-year risk profile, you have a 66% increased risk of developing type 2 diabetes. So yes, blood sugar less than 100 is good, but it's not optimal. It's far from it. 75 to 85 would be an optimal range. There's other markers that you want to look at, though, that go beyond just blood sugar. A1C hemoglobin is a 3-month average of glucose regulation. This allows us to assess how well your body has been regulating blood sugar over the last 3 months. Also, using fasting glucose and A1C, you can calculate your estimated average glucose. You can see here that his estimated average glucose, or his average running daily glucose, is borderline high. Insulin is one of the most important markers if we're talking about blood sugar regulation. Insulin, you can see here, is at 19. Now, optimal, I consider optimal to be 9 or less. 20 or above is a pretty strong indicator of, one, pre-diabetes, but also developing type 2 diabetes. And typically, the way that this works out is you're going to have normal glycemic response, normal glucose response. Then you're going to start to see impairments in something called postprandial glucose regulation. The only way to really figure this out is if you do a postprandial insulin or postprandial glucose assessment. What that means is you check your blood sugar before you eat your food, you check your blood sugar 1 hour later, 2 hours later, 3 hours later. You would do the same thing for insulin, and you want to see how your body's responding to food. But if you don't do that, of course, you can just measure your insulin and see what's going on there. When I see insulin greater than 9, like I said, it's a dysfunction. It definitely indicates pre-diabetes or trend towards developing type 2 diabetes. And all this leads to basically insulin resistance. And once you have insulin resistance, you now run a very thin line between passing into something that we call metabolic syndrome. And this is basically the gateway for atherosclerosis, damage to your vascular system, your heart, things like type 2 diabetes, obesity, weight loss resistance, cancer. All of these things, actually, the risk of them are going to start to increase if we're really not paying attention to all this. And what happens is your insulin becomes dysfunctional way before blood sugar and A1C. In fact, if his doctor was properly assessing him, this might be something that would have been brought up a few years ago, rather than finding out later in the day or later in your life that these problems are developing. Fructosamine is a way for us to assess blood sugar regulation over the last 3 to 4 weeks. A lot of times these are very helpful for me to be able to understand if somebody made, immediate changes leading up to their blood sugar to try to, hack their numbers, rather than, being consistent with their diet, right? So that's why all of these are very important. There's some other markers here and calculations that are also very important. C-peptide. C-peptide is a very important marker to understand insulin resistance and sensitivity. Insulin resistance is not good. Insulin sensitivity is what you want. And as you can see here, his C-peptide was pretty elevated, again, suggesting that we're having some insulin dysfunctions. And these are things that we can begin working on and optimizing rather than waiting for the day that he's got full-blown diabetes and then saying, oh, this is something that we should be working on. There's also calculations that a lot of times doctors just are not doing. As part of blood chemistry analysis. Doctors typically make their orders, labs come back, they look at them, they just go off the traditional reference ranges from the lab, which are largely inaccurate. And then even then, they're not going to do any calculations. But these HOMA calculations, HOMA 2B stands for beta cell, HOMA 2S stands for sensitivity, insulin sensitivity, HOMA 2IR, insulin resistance, and the quickie score. These are all calculations that allow us to assess outcomes and allow us to assess how well the individual is handling blood sugar as a whole. You also have another marker called glycomark, or 1,5-anhydroglucitol. This is a marker that is helpful because there's a percentage of the population that they glycate and their A1C hemoglobin numbers are going to be abnormal, regardless of whether or not they have diabetes, hyper or hypoglycemia, too much blood sugar or too little. And so the glycomark assessment is very helpful to see, does this person have insulin resistance or insulin sensitivity? And so again, I'm using this as an example because this particular individual was told that everything was okay, there was nothing to be concerned, and at a minimum, he's got prediabetes. There's a few markers here that are suggesting the development of type 2 diabetes. Wouldn't you want to know way before, so that way you can make some changes rather than waiting another year or 2 years to only be told you've got type 2 diabetes and now you've got to treat that. So that's the point of this video. I just wanted to share some of this information because there's a lot of testing that I know that people get done every year, but unfortunately they're not getting appropriate testing. And so for you to assume that you're healthy, that's not good, because the last thing you want is for your house to be on fire and you don't know about it, right? Until the fire department's there trying to put the fire out. So you got to be careful with these things. You got to make sure you're getting appropriate testing. And if you're not, you got to ask your doctors to do this.